Okay, let's talk about that cough. You know the one, that deep, nagging cough that just won't quit. And every time it happens, you can't help but wonder, should I be wearing a warning label? Am I spreading this to everyone around me? It's a super common worry, so let's get to the bottom of it.
Right, so here's the big question. Is your cough basically a transmission machine, launching germs across the room? Are you contagious? Well, the answer is a little more complicated than a simple yes or no, and frankly, it's probably not what you think.
So first, let's make sure we're all on the same page. What even is bronchitis? Well, put simply, it's when your bronchial tubes, those are the airways that carry air into your lungs, get all inflamed, swollen, and irritated. That's what causes all the coughing.
And here it is. This is the single most important thing to understand. Whether or not you're contagious has almost nothing to do with how loud you're coughing or how much gunk you're coughing up. No, it all comes down to one thing: what caused that inflammation in the first place.
And that idea, the cause, is what splits bronchitis into two totally different conditions. You've got acute bronchitis and you've got chronic bronchitis. They might share a name, but trust me, they are two completely different beasts.
So here's the core difference right here. Acute bronchitis, that's almost always caused by a virus. Yep, the exact same viruses that give you the common cold or the flu. But chronic bronchitis, that's a different story. It's caused by long-term exposure to things that irritate your lungs, like cigarette smoke or air pollution. So one is like a short-term invader, and the other is a long-term irritation.
And when you look at them side by side, it becomes crystal clear. Acute bronchitis, because it's from a virus, is absolutely contagious. The good news? It's usually over in less than 3 weeks. Now, chronic bronchitis, since it's caused by an irritant and not a germ, is not contagious at all. But it's a long-term thing. It can stick around for months or even keep coming back for years.
Okay, so let's zero in on the one that spreads, the acute kind. If that's the one you can pass on, how exactly does it make the jump from you to someone else?
Well, it spreads exactly how you'd expect a cold or flu to spread. When someone with acute bronchitis coughs or sneezes, they release these tiny little droplets filled with the virus. So, to be clear, people aren't catching bronchitis, they're catching the virus that causes it. And yeah, it's almost always a virus. A bacterial cause is actually super rare.
So here's a really handy rule of thumb to keep in mind, the 3-week rule. If you have acute bronchitis, that first week is usually the worst. By week 2, you should be well on your way to recovery. But that 3rd week, that's kind of the magic number. If your cough is still hanging around after 3 weeks, that's when you start to think it might be chronic, which means you need a whole different game plan.
So what do you actually do about it? Well, since we're dealing with two different conditions, you need two different action plans. For the acute kind, your goal is simple: recovery. For the chronic kind, it's all about long-term management.
All right, if you've got the contagious, acute kind, your job is to help your body win the fight. For starters, try to isolate yourself for at least the first few days. That protects everyone else. Then, it's all about rest, letting your body heal. Drink tons of fluids to stay hydrated. And you know, a humidifier can be a real game changer for soothing your irritated airways.
Now for chronic bronchitis, the playbook is totally different. You're not contagious, so the focus is all on you and managing the condition. Step 1, and it's a huge one, is to get away from whatever is irritating your lungs. Quitting smoking is number 1. After that, your doctor might prescribe inhalers to help open up your airways, making it easier to breathe. And from then on, it's all about keeping an eye on your symptoms to catch any flare-ups.
But, the best approach is always just not getting sick in the first place, right? And the good news is, the things that work are really simple. Wash your hands often, wear a mask if you're feeling sick, and stay home. And of course, keeping up with your flu and COVID-19 shots helps stop those viruses before they can even start causing trouble. Look, taking care of yourself at home is great, but sometimes it's just not enough. It is super important to know when to stop self-diagnosing and go see a doctor.
So what happens when you go? A doctor can usually figure it out just by listening to your lungs with a stethoscope. They might order a chest x-ray to make sure it's not something more serious, like pneumonia. And here's a key thing to remember. Since most bronchitis is viral, antibiotics are not going to help. Oh, and if you have asthma, you've got to be extra careful, because bronchitis can really trigger some serious breathing problems.
Okay, listen up, because these are the red flags. These are the symptoms where you don't wait around. If you have a high fever, any kind of severe chest pain, or you're struggling to breathe or feeling short of breath, you need to get medical help right away. Seriously, don't mess around with these.
So let's boil it all down. If you walk away with just one piece of information,
Let it be this. If the cause is a virus, it spreads. If the cause is an irritant, it stays with you. It really is that straightforward. It all comes down to this single idea. It's the underlying cause, not the cough itself, that decides if you're contagious. So the next time you hear someone, or yourself, coughing, try to think beyond the sound. Think about the source, because that's where the real answer is.
So I'll leave you with this to think about. Before this, what was the biggest thing you had wrong about coughing and being contagious? Because really, knowing the difference is the first, most powerful step you can take to keep yourself and everyone around you a little bit safer.